Welcome everyone, I'm here with Mark from Cosmo Insurance Agency and we're going to be going over the top questions from our clients related to compliance going into 2024.
This is a lot of questions that we got in the past month of January, as you can imagine now with all the compliance rules and regulations. So let's just dive into it.
First question. If an employer is an applicable large employer, so ALE with 50 plus employees, when can they start using the new 2024 affordability rate of 8.39 if their plan renewal is on April 1st, 2024?
So it really depends. So if, like you just said, if their plan renewal is April 1st, 2024, it starts when their plan renews. So we shouldn't get confused that now immediately after January, you could start charging from your employees that new ACA rate of 8%. So it's when your plan renews. So for example, if your plan renews April, it's going to start April. March, it's start March.
Great, perfect. Next question. When are employers required to include the cost of healthcare on W-2 forms? And what if there are 3 companies in the control group?
So yeah, for sure. Then only if you have 250 plus employees, that means W-2 employees, then they're required to include it on box 12 in the W-2 form. If it's 3 control groups, then you add all those 3 groups together. So if you have 3 groups that are 250 less, then you do not have to put in the box 12 in the W-2. So it combines all 3 groups. It's considered like a regular control group, like you have a control group. You have to offer them all insurance out, all 3 control groups.
And if of those employees some are 1099, you don't count them towards.
No, you don't count the 1099s. Only W-2.
Perfect. Next question: do Section 125 plans need to be renewed annually?
No, but of course we advise everyone to renew it annually. We actually help prepare this form, so it's really easy. But you just got to do it once.
Next question: can a parent or employee use FSA funds to pay for a COBRA plan if their child who just turned 26 is terminated from their parent's plan?
Great question, and we get that all the time as part of these questions. So no, you cannot use the FSA. However, the HSA can be used to pay towards the COBRA, but not FSA.
So, next question. Is a domestic partner treated the same as a spouse for health insurance and related benefits?
So no, it's so easy to get married today. But however, you do have to be actually married in order to get benefits for a husband and wife, and even if it's same gender, you got to be married to each other as well. But here in New Jersey with Rising Blue Cross Blue Shield, actually, they do allow, if it's same gender, then you do not need to get married. It could just be a domestic partner.
Interesting.
But if it's opposite gender, domestic partners will not work at all. You gotta get married.
Depends.
It's easy to get married, just get married.
Yeah. For ACA, COBRA, and MSP, how do you count the group size if an employer has both union and non-union employees?
So union and non-union employees, union is considered like their employee, so therefore they count towards that group size. So for example, if you have 10 union employees, 10 non-union employees, that's going to be a total of 20. So now we could go into each category. So if you're COBRA, that's going to be 20 plus employees total, and then you will be required to offer COBRA. Regarding Medicare, so Medicare is primary, so which means that your Medicare is primary if you're 20 plus employee, that's MSP, and then so your Medicare will be primary if it's 20 plus employees. And then there was one more item, which is the ACA. So the ACA is also 50 plus employees. So let's say, for example, if I got that 10 union employees and then 40 non-union, now you consider it a large group. So it's going to be a large group when you have the union and non-union employees.
Last question. What is the stability period under the ACA?
So first, let's explain what stability period means. Stability period means you're guaranteed coverage. So what that means is that if you are required to provide, if you are an ALE with 50 plus employees, you're required to provide minimum essential coverage, minimum value plans, all in the Affordable Care Act guidelines. So if you have had 50 plus employees, and now we're talking about in 2023, then you are considered a large group for 2024. So say you have one of your employees was full-time in 2023 and now they became part-time. Interestingly enough, that employee will be able to have the coverage for 2024, even though now they're part-time, because that's the stability guaranteed coverage for 2024. So if they now became part-time, they will be able to keep their coverage for 2024.
Interesting. So the stability period is basically one plan year after the year that you worked, that you were full-time.
Exactly, but that's how we calculate that if someone's a 50 plus group from the preceding calendar year.
Amazing. Well, that's really, really interesting. Thank
It
you so
is.
much for answering all of my questions.
Yeah.
Thank you guys for watching, and make sure you guys subscribe for more compliance-related questions, and stay tuned for our next video.
Yeah, feel free to always reach out to us with any questions, as these are lots of the questions that we've been getting, and look forward to doing another video with you guys. Thank you.